Good afternoon. Thank you for watching our live briefing for Tuesday, September 22nd. I want to start out, I learned today that we have some residents from Westminster Canterbury Lynchburg who routinely watch our live briefing. I wanted to say hello and thank you for watching and paying attention to what we're doing here in Richmond. It's nice to know you're out there. Today, I have a quick update on the COVID situation on campus, and then we have some big news for you today relative to visitation on campus that I'll share some of, and Will Blackwell will share more of the details. Then I'm really pleased today to have one of our recreation therapists, Kendra Spencer, who works in Parsons Health Center. She's here today to share some of the great activities that they've been doing with our residents to keep them active and connected. And so she'll spend some time sharing those things with you. And then lastly, Vanessa Perry from Pastoral Care will have some scripture and a prayer for us. So now real quick for our COVID update. The Gables and Monticello areas on campus will hopefully come out of quarantine this Saturday, September 26th, assuming we continue on the same trajectory we've been on here with no new cases, and we're really pleased about that. As you'll recall, we have 2 residents who are currently positive for COVID-19. They were both moved a couple of weeks ago to the COVID-19 positive unit, where they've been since. Both residents have been retested, and thankfully both residents remain asymptomatic and doing very well, and so that's really good news. We're just waiting on their negative test results to come back so we can get them back to their homes in assisted living. We continue to have 2 staff members who have tested positive and continue to recover at home, and we're eager to get them back to work. So now shifting gears to talk about visitation. As I mentioned, we have some big news to share today. Over the course of the past number of weeks, I've told you repeatedly that as soon as we have more information about the changing guidelines relative to visitation, we'd share them. And I apologize today for not being able to give you more notice on this, but this new guidance from the Centers for Medicare and Medicaid Services were given to us late Thursday afternoon after we spoke to you in the live briefing. But we'll share some details today, at least the broad outline, and we'll share more of the details on Thursday with you this week. So as I said last Thursday, the Centers for Medicare and Medicaid Services, we call that CMS, released new guidance to all nursing homes nationwide. And the new guidance is relative to nursing home visitation during the COVID-19 public health emergency. Since Thursday, we have been working through the details of this new guidance and making preparations to implement this guidance in a safe, controlled way. This new CMS final rule allows visitation in Parsons Health Center with certain conditions. Today, Will Blackwell and I are going to talk through what this means for Westminster Canterbury, and we will share more details and the specifics on Thursday, during Thursday's briefing, and you'll also get this in written form later this week. So here's the important news. Westminster Canterbury Richmond is implementing new visitation for the entire campus on Monday, September 28th. As we prepare for this visitation, we're going to ask and require that everyone continue to adhere to the same screening protocols we've had for everyone who comes on campus. Residents and their visitors will need to practice hand hygiene and wear face coverings or masks and maintain social distancing. Westminster Canterbury and all of our staff will need to wear all of the appropriate PPE. We need to clean and disinfect all of our high-touch surfaces and areas. We need to create, we've already done this, create and maintain the capability for cohorting people who test positive. We do that through our COVID positive unit, and we'll keep that unit even if no one's residing there. We keep the unit, and we're ready to use it if we need it. And then we need to comply with all the CMS regulations for staff and resident testing. So we're going to need to work through all that for this to work. Now, I want to take a second and I want to speak to our visitors, families and friends who are going to be coming on our campus and visiting with their loved ones and friends in Parsons Health Center and in our assisted living community. Please remember that this community of seniors are our most vulnerable population when it comes to this virus, and we need every family member and every visitor to help us keep them and each other and us safe. So the most important thing you can do is, if you don't feel well, please postpone your visit, wait till you're well. Take your temperature, ensure you don't have a fever, and really think about, do you have a headache? Do you have any nausea? I mean, the smallest symptoms are the same symptoms we have to get tested and stay away from work. We need you to take the same precautions if you don't feel well. Please just postpone your visit until you're feeling better. So beginning Monday, September 28th, visitation for all areas of campus will be allowed daily, 7 days a week, between the hours of 10 a.m. and 9 p.m. There may be other special prearranged situations, but we want all visitation to happen during these hours. There could be a situation where where someone might need to come in at other hours, and we need you to work with us, and we'll make sure that we can do that. All visitors will be screened at the Avalon entrance. They'll get their screening, they'll answer their screening questions, get their temperatures taken, receive a wristband, and be directed to park near the area where they're visiting. This is a change, especially for independent living, where today your visitors are coming in and getting screened at the Spiritual Center. Starting Monday, we're going to direct everyone to the Avalon entrance. Residents, when you come and go, you're still going to get screened at the gate. Everyone else gets screened at Avalon. Consolidating this helps us in terms of how we staff that, because this is going to be a strain on our systems. Visitors are not going to be allowed in the dining room or other common areas, and they should directly go to the area where they're visiting, either in independent living, assisted living, or healthcare. They need to go to that area and stay with the resident that they're visiting. We are committed to allowing this visitation, but also at the same time maintaining everybody's safety. This is going to put a lot of strain on our staffing situation for this screening operation, which is already a very challenging operation for us to staff. So please be patient, offer staff grace. They're working in some tough conditions to make sure that everyone gets screened. And as the temperatures drop, it's hard to get everybody through that screening, that temperature screening, in a timely way. So please be patient. The last thing I'd say is, because of the change that's coming next week, the last day for our Friday delivery program for families and friends will be this Friday, September 25th. So we're not going to do that anymore after this Friday. That was a lot. And to provide you even more detail, I'm going to invite Will Blackwell up here, and he can give you some more of the details and some of the CMS, some of the rationale for what CMS has done here. So let me get out of the way and invite Will up.
Good afternoon, everyone. At the end of last week, CMS issued new guidance for visitation in nursing homes to provide reasonable ways to safely facilitate visitation and to address psychosocial needs of our residents. I'm going to share with you some of the information from the memo. We will share details of the process for visitation on Thursday. CMS says that visitation should be person-centered. Consider the resident's physical, mental, psychosocial well-being and support quality of life. Visitation can be conducted through different means based on the facility structure and resident needs, such as in the resident rooms, dedicated visitation spaces, outdoors, and for circumstances beyond compassionate care situations. The core principles of COVID-19 infection prevention consistent with CDC guidelines should be adhered to at all times. When you come to visit us, you will see these reminders of our core principles of COVID-19 infection prevention. We must continue to adhere to screening protocols for all who enter. You will not be permitted to enter if you have any signs or symptoms of COVID-19, and you must be honest with your answers. We must practice hand hygiene, wear face mask coverings or masks, maintain social distancing, wear appropriate PPE, clean and disinfect high-touch surfaces and areas, continue to have the COVID-19 unit, and then comply with CMS regulations for staff and resident testing. In addition, CMS outlines directions for nursing homes to alert visitors as they maneuver through the community, including instructional signage and visitor education on COVID-19, infection control, and nursing home policies. You will see signage to help you find your way to the closest entrances and paths to your destination. Following a person-centered approach and adhering to Centers of Disease Control and Prevention, CDC guidance, nursing homes can now accommodate visitors. Outdoor visitation. CMS states that outdoor visitation is preferred because there is a reduced risk of transmission with increased space and airflow. However, there are hindrances to outdoor visits that nursing homes must consider, including weather conditions, temperature, air quality, and the individual's resident's health status. We are looking to create accessible and safe outdoor spaces for visitation. CMS states the organization should have a process to limit the number and size of simultaneous visits as well as the number of individuals visiting, all while adhering to safe infection prevention actions. Indoor visitation. Nursing homes should accommodate and support indoor visitation based on specific guidelines CMS has outlined. First, the nursing home should have no new onset of COVID-19 cases in the last 14 days and not currently conducting an outbreak testing. Second, CMS reiterates that visitors must comply with and adhere to the core principles of infection control, and staff will need to monitor for any visitor having difficulty adhering. Third, an organization should limit the number of visitors per resident, as well as the number of visitors in the building based on the size and physical space. Ideas to help limit could be scheduling visits at certain times and days and limiting the length of time of visits. Lastly, organizations must limit movement of visitors in the facility. A visitor should not walk on neighborhoods or units where they will not be visiting the resident. In other words, stay where your resident is living. This is where signage will help visitors move throughout the building. Visitation will begin Monday, September the 28th, 2020, from 10 a.m. until 9 p.m. Parsons Healthcare Center visitation will be limited to one person visiting in a room at a time to ensure proper safe social distancing. Groups of 2 or more can be scheduled in the Rice Assembly or outdoors. We will share more on how to do this on Thursday. Now, assisted living, Avalon, the Gables, and Monticello have been coordinating safe, structured visits since July. With this new plan, families will no longer need to schedule those visits. Additional guidelines for visitation are under development, and we will share more on Thursday. We look forward to seeing you safely. Next week, please make sure you follow the core principles of COVID-19 infection prevention. Kendra Spencer is up next.
Hi everyone, my name is Kendra Spencer and I am one of the recreation therapists serving our healthcare residents. Collectively, my colleagues Lori Capers, Hallie Castetter, and I have been serving our residents for over 34 years at Westminster Canterbury. Our love for them has not changed. In fact, it continues to deepen with each passing day. I'd like to give you an update on all the activities we have been doing with our residents in Parsons Health Center during COVID-19. As you may know, various wings of each floor or an entire floor have been in quarantine at some point. When I spoke to you in April, I mentioned birthdays, hallway activities, and FaceTime calls. Well, all those are continuing to occur. Fortunately, more activities are now available now that we are moving into the right direction with our COVID numbers. Bingo is still very popular and has been enjoyed by residents on First and Third. All residents on First continue to be oriented to what day of the week it is, especially when it is Thursday. It is very common to hear, "Oh, it must be Thursday," in response to a knock on the door and Lori walking in with a fresh-baked, warm chocolate chip cookie. Lori has been providing this very simple but meaningful activity every Thursday for our first floor residents for over a year, and they truly enjoy the cookies and the quick one-on-one check-in that Lori provides. Several residents on Third get special attention from Haley when she paints their nails. This gives the residents a chance to be pampered and to socialize, which makes such a big difference for them. Thanks to gifts to the foundation, we have several iPads to use to access Linked Senior, which is a software app that provides various mental stimulation activities that residents enjoy doing. Residents also use Linked Senior to play bingo. On the second floor, we use the Apple TV often to live stream several of our musicians that we were so used to having on a weekly to monthly basis. Music is so meaningful to our residents for a plethora of reasons, and to see them engage with the music and see a familiar face is truly remarkable and wonderful. We also enjoy playing a fun game of pool noodle balloon hockey. One of our residents, who typically says no to my activity invites, participated in this game. She was focused and she laughed often. Come to find out, she was a very competitive person in her early years. That competitive spirit of hers came out, and that too was wonderful to see. Residents do get outside also. One gentleman from second floor was taken out to the porch on his hall, and as soon as his feet stepped out across the threshold, he took a deep breath in and out and said, "I love this." He had a huge smile on his face. The biggest accomplishment and the most therapeutic intervention that we continue to offer have been FaceTime, Zoom, and Skype calls. Between the 3 recreation therapists, we conduct over 330 calls a week. We hear all the time from family members how much they appreciate being able to connect to their loved one. That it has been their lifeline through COVID. A daughter of a resident recently told me that she would not be able to make it through the week without these calls to her mom. Wow. I have to agree with Sarah Merchant, who presented last week, when she said that our residents inspire us as well. During this time, our residents have truly been amazing. They have handled this disruption to the normalcy of their lives with such strength and grace. I want to say the families have inspired me as well. You all have been so patient. Your strength and support really come through on each call. You are so uplifting, loving, and caring. Just yesterday, I heard a wife say to her husband, "I love to see you laugh." And the husband replied, "Thank you for making me laugh." The love between our married couples is so inspiring. Another uplifting call I get to experience weekly is between a husband and wife who pray together during the call. This is so meaningful to them as a couple, and during this call they can still fulfill their religious needs together. I can go on and on about the connections we are able to see daily as we witness these calls. Just know that you all inspire us every day with the love you show toward your loved ones near and far. Just an interesting fact, we connect residents with loved ones throughout the United States and in Argentina, Hawaii, London, and Prague. You can say we've gone global. On a simpler note, I want to assure you that while residents are in their rooms, or when they request something to do such as drawing, painting, crossword puzzles, planting, we are able to provide these items to the residents. We want to thank everyone who supports our efforts. As I end my update, please know that the three of us are grateful to our residents and their families for letting us truly become part of your lives. You really do help make us feel like we are all in this together, and that our community really is a family. Sometimes it can be challenging, but we always come out of it better and more determined. Look at me after 16 years of working here. I love my work, my colleagues, and my residents. One last mention, next week, September 28th through October 2nd, is Alzheimer's Week. We are showing a different movie a day at 12:30. We will not be hosting our walk this year, but if it's a nice day, feel free to go walk the beautiful grounds of Westminster Canterbury. Please see the details for more information. Thank you very much, and here's Vanessa.
Good afternoon, everyone. Join us for worship this Thursday starting at 10:30 a.m. via TV 970. Leanne Ring, who's our Pastoral Care intern, will be preaching, and Reverend Dr. Lynn McClintock will be officiating. The pianist will be Susie Frazier. The Spiritual Center will be open to residents and staff on the afternoon of Monday, September the 28th. Pastoral Care staff will be available to answer any questions. Please wear a mask and maintain social distancing. An evening prayer called For the Hope of Tomorrow by Jill Eisnagel. And now I lay me down to rest. I thank the Lord, my life is blessed. I have my family and my home and my freedom, should I choose to roam. My days are filled with skies of blue. My nights are filled with sweet dreams too. I have no reason to beg or plead. I have been given all I need. Beneath the subtle moonlight glow, I thank the Lord, so he will know how grateful I am for my life in times of glory and of strife. The times of glory give me hope. The times of strife teach me to cope. Thus I am much stronger in turn, yet grounded still with much to learn. Now I lay me down to rest. I thank the Lord I passed the test of yet another day on earth, grateful for its abundant worth. This day has been a special dream from morning to the last moonbeam. Yet should the coming dawn bring sorrow, I'll rise thankful I've reached tomorrow. Please join us for our next update on Thursday starting 3 p.m.